Welcome to this educational video for New Life Center for Bariatric Surgery. This video has been prepared by your dedicated weight loss surgery team. We hope this video will guide, support, and educate you as you go through your medical plan.
Hello, my name is Dr. K. Rob Williams. I'm a surgeon at New Life Center for Bariatric Surgery. In my line of work, I often encounter patients with obstructive sleep apnea. For those of you who are not familiar with this condition, it is a very common sleep disorder that is characterized by pauses in breathing, infrequent breathing, and shallow breathing. Our patients with obstructive sleep apnea will often have pauses that can last anywhere from 10 seconds to several minutes while they're sleeping, and these can happen as often as 30 times per hour. In our patients with obstructive sleep apnea, this is often a result of airway occlusion. The patients that we see with morbid obesity oftentimes have an increased tongue-sized, thick neck tissues which can predispose them to airway collapse when they're lying on their back or when they're relaxed, such as periods of sleep. The symptoms of sleep apnea often include sleepiness, fatigue, slow reaction time, poor memory, decreased attention span, and moodiness. What's actually happening during sleep is that the oxygen levels are dropping, the carbon dioxide levels are rising, and while the symptoms that occur early in the disease may not be very concerning, over time, problems with heart and lung function can occur. This can lead to reduced heart function and efficiency. When unrecognized, patients who are undergoing weight loss surgery can actually develop respiratory failure or apneic arrest. This makes it critical to diagnose and treat sleep apnea before weight loss surgery. The gold standard for diagnosis is what we call polysomnography or sleep apnea testing. This will involve going to a sleep lab and having your sleep closely observed. If it turns out that you have sleep apnea, the treatment depends on the severity of the disease. In mild cases of sleep apnea, often changing sleep techniques will help, like avoiding alcohol or sleeping on your side. But in more severe cases, patients will require a CPAP or a BiPAP machine. CPAP is continuous positive airway pressure. BiPAP is bilevel airway pressure. Both of these treatments involve applying a mask during sleep to help keep the airway open and improve oxygenation and ventilation. Oftentimes, a sleep apnea machine will help improve patient symptoms by avoiding some of the fatigue and sleepiness and help avoid some of the long-term complications. When you come in for your consultation, if you've not previously been diagnosed with sleep apnea or tested and you have some of these signs and symptoms, we will arrange for a sleep apnea test. And while a sleep apnea machine can be an excellent treatment in the short term, it's not the best long-term treatment. We find that weight loss is the best long-term treatment, and oftentimes in our patients who undergo weight loss surgery, 60 to 70% will have a resolution of sleep apnea and not require any further treatment. I'm Dr. K. Rob Williams. Thank you very much for your time.
Thank you for watching this informative video. We hope this video makes it easier to achieve your goals and be an active participant in your care. Please feel free to visit newlifebariatricsurgery.com for more support and information.